Breastfeeding is often called a child's first vaccine and the best food for life. Why is breast milk so unique compared to any other food?
Absolutely. Very, very critical and important question. And we must understand this if we are to really help our babies to grow and develop to their potential. Now, number one, what happens once the baby is out? There is breast milk secretion that starts. The initial breast milk is called as colostrum, which is kind of first thick yellowish, milk that comes in drops in the initial 1 or 2 days. It's secreted almost like 40-50 ml throughout the day. Now, it's very important to understand that baby's stomach capacity in the first few days is very small. Like day one, it's like 5 ml or so. The whole stomach capacity is 5 ml, like a cherry. It increases slowly, like at day three, it becomes like 20 ml, and at day seven, it becomes 40 ml. So, in order to really accommodate packed nutrients and energy into that smaller stomach size, colostrum is secreted, which is very thick and very nutrient dense. Not only energy dense, it also contains some of the antibodies, white cells, which provide protection from any infection that baby can acquire in the initial days of life in the external world. And then it also has some, purgative effects. So baby can really pass out the meconium or any harmful secretions that baby has in the intestine. They can pass out with the help of this colostrum. It's also useful in maturation of the gut or intestines, and it also has a lot of vitamin A rich components. So that's the first milk, or called as colostrum, and which is very, very unique for human being, and then it helps babies to prevent infection. Now, as you mentioned, you asked what is there in breast milk. So breast milk has all that a baby needs till 6 months of life in terms of nutrition and hydration. It is hygienic and safe. And we all know that there are two types or kinds of milk secreted by breast. They are called as foremilk and hind milk. So something that comes when the baby latches onto the breast and starts sucking, it's called foremilk, and it is quite thin, and a lot of watery content is there, so that it takes care of hydration of the baby. While as the baby goes on to breastfeed on the same breast, then there comes the hind milk, which is more thickish, creamy, and has more fat and nutrients, and which is helpful for the baby to grow. And hence it is critical that we provide both foremilk and hand milk to the baby for the complete nutrition that baby can get from the breast milk. Human milk is also tailor made to the needs of the babies. So if a mother delivers early, like for example, the mother delivers in 37th week or in 35th week, so the baby is preterm, so baby is premature, and hence, according to the maturity of the baby, the breast milk gets adjusted. And this is the kind of nature's charisma, we can call it, because it is tailor made. So no company or no manufacturer can do it as per the need of the baby, and hence it is also called as vaccine for the baby. It is very easy to digest, has optimal proteins, essential fatty acids, which are helpful for physical growth as well as brain growth. More importantly, it is always ready. You don't have to cook or prepare or do anything to breastfeed. It's at the right temperature as per requirement of the baby. So you don't have to do anything from the external world, and it is available for the baby. Now, we also think that it is only useful for babies, but it's not so. It's also useful for the mothers because it facilitates, expulsion of placenta, contraction of uterus. So there is no extra bleeding that happens post delivery. It decreases the risk in future of breast cancer, ovarian cancer, or uterine cancer, and it assists in losing fat post pregnancy. So it helps mother to get back into the pre-pregnancy weight or pre-pregnancy shape. Um, and of course, it helps in delaying next pregnancy. All these are advantages for mothers. In fact, not only in immediate future, but also later, it also protects from post-menopausal osteoporosis or resorption of calcium or, uh, uh, weakening of bones, which is called as osteoporosis. So it helps from that, against that also. So all these are effects which are very, very useful for baby as well as mother, and hence, this breast milk is very, very unique for human beings. If we look at from the public health point of view, uh, if babies are initiated on breast milk within 1 hour of birth, we can save 22% of neonatal deaths from happening. So we all know that deaths in the first month of life is the most common thing nowadays, compared to under five deaths that used to happen in the past. But now it's the neonatal deaths that is the biggest challenge, and if 22% of them can be saved if we initiate breastfeeding in within 1 hour of birth. Looking forward beyond deaths, breast milk also helps to have healthier metabolic programming and insulin sensitivity, and hence it reduces the risk of future obesity and type 2 diabetes that infants may have. So it's very important for that also. It helps in regulating healthy blood pressure and promoting vascular health. And more importantly, on a positive side, it enhances cognitive development. It has, those long chain polyunsaturated fatty acids, which are critical for brain development. And also, breastfeeding provides an opportunity for an interaction and close, bonding with between the mother and the child, which helps again in improving, in enhancing the neurodevelopmental stimulation, and thus overall contributing to improved cognitive development. So all these are kind of advantages for mother as well as baby, and hence breastfeeding is very, very important, and human breast milk is very unique for that child.